Hello, my people. Hello, viewers. My name is Obichukwu Daniel Aniekwe. I'm a medical doctor by profession. I'd like to talk to us about some certain health issues that will benefit us and our families and loved ones. I am not here to give a medical lecture as a medical doctor. I'm here to give a medical advice and to guide viewers, especially the non-medical viewers that will watch this video on certain health issues. But today I'm going to discuss a simple health topic. A topic I see every day in my clinic, and people talk about it, and when you ask them how they come about the information, they said that is what everybody is saying. It's all about teething in children. You notice that most of the time our people, mothers, parents, caregivers will tell you that once a baby is sick, it's because the baby is teething, especially children of under 5 years of age. But I have heard so many stories about teething in children that has prompted me to make this video so that I can help to correct certain wrong impressions that our people has about teething and see if I can save so many of our children from untimely death. What is teething? Teething simply means the eruption of a new tooth from the gum, the outburst of a new tooth from the gum. And this teething we are talking about starts most of the time from 5 or 6 months old baby, and runs through childhood even into an older child or older children, even up to 10 years. Children are still teething. Now that is simply what it means. And in teething there is what we call primary or temporal teething and permanent teething. Whether temporal or permanent, they are all teething. Now, I have seen mothers and caregivers, parents, they tell you that, but the child is teething. No, my neighbor said it's because he's teething. That's why the child is having fever or high temperature. When a child is vomiting, they say it's because he's teething. When a child is having watery stooling or diarrhea, they say it's because he's teething. If a child convulses, people say it's because the child is teething. Now, whatever a child is having, as long as it says health issues, they attribute it to teething. I want us to know that teething is just a normal physiology, it's a normal body mechanism. It is something that's supposed to happen. It's not meant to happen in association with ill health per se. Okay, so when a child is vomiting, having high fever, coughing, catarrh, flu-like symptoms, diarrhea, it's not because the child is teething. Teething is a normal physiology, just like a child has to talk or see, hear, sit down, crawl, stand and walk. They are all normal physiologic things. But you can also bear me witness that when a child is trying to sit down, crawl, stand up and walk, the child may fall and wound himself. But it's not because that the child is standing that's made the child to wound himself. It's just an associated occurrence. Therefore, teething. Why is it that children below 3 years, when they are teething, they fall sick? There is what we call oral stage in child growth. This oral stage occurs simultaneously during teething in early, childhood. From 5 months, 6 months to a child of about 3 years is passing through oral stage. Most of the time, oral stage is marked by teething, that is bringing out of tooth. And you see a child picking things and be putting in his or her mouth. And most of the time, these children have started sitting or crawling. They can reach out to something, object, and put them in their mouth. And by so doing, they will contaminate themselves with the bacteria around. And when they fall sick, mothers and parents and guardians, we said it's because they are teething. It's not the teething that causes it, but it's because of the lifestyle that is associated to the stage of the stage of life where they are at that point in time. It's called oral stage. Oral stage means mouth stage, a stage whereby anything you pick, put it in your mouth. That's what it means. At that stage, anything you give to the child, he or she will put it in the mouth. If you are not careful, some of these mothers will even back their children or their child without knowing that they are licking their hair. The chemicals from the hair, or a hair that is coated with dust from the environment, and after licking it or licking the mother's clothes or the parent clothes, the father or the caregiver, the child may fall sick, and you say it's teething. So this teething coincides with this oral stage, and because of the poor hygienic lifestyle at that stage, these children infect themselves and they fall sick. Therefore, I would like to guide and advise our mothers, our parents, caregivers, not to always associate every ill health a child has or a child is having to teething. I tell you of a truth, over my years of experience in practice, this concept of teething, this ill concept of teething, has killed so many children, has caused the death of so many of our children, especially in Africa and Nigeria. And our environment is dirty. Our environment is polluted. Therefore, I would like to beg, once a child is sick, please take your child to the hospital, or at least do your best, what you can do. That's what we call self-medication. After which, 2 days, 3 days, if it's not getting better, please take the child to the hospital. But don't just do nothing and say the child is teething. A lot of children has actually died because of this, and sometimes parents or mothers will present late to the hospital because they have delayed so much at home without doing anything. They said it is teething. Now, I have made it clear to you that though the sickness that is associated with the state they are is not because they are teething. Teething can only cause mild gum itching that makes them to want to eat everything they lay their hands on. Teething can cause mild discomfort, very, very mild. It can cause very mild raise in body temperature that is insignificant to cause a health, disease or an illness. So it's not teething. Please spread this message. Spread this message, because there are so many misconceptions about teething. Here, everybody, and all these mothers, all these people that are saying this, once you ask them, how do you know? How do you come about this first? He will tell that That is what everybody is saying. Or they will tell you that my mother said, my father said it, my mother-in-law said it, my brother, my sister is saying it. That everybody, they are saying it, it doesn't make it to be true. Medicine is science. Once you cannot prove it, then you are not making sense. Okay? So there is no proof that is teaching that when a child is teething, you start having diarrhea. I want you to know that a child of 6 years, 5 years, 6 years, even up to 10 years and above is equally teething. Why is it that when a child of 6, 7, 8, 9, 10 years is teething, he or she will not be falling sick? Simply because a child at that age has outgrown the oral stage of his life. Because a child of 8 years is no longer picking things from the floor and be putting in his mouth. A child of 8, 10 years has known that he or she has to wash his or her hand before eating any food. But a child of 5 months, 6 months, 1 year, 2 years, 3 years does not know that he or she has to wash his or her hand before eating. You understand? That is why you that is listening to me, you should ask yourself, when you are like 7 years, 8 years, 10 years, your tooth has fallen off and you have it in your hand. You throw it away. Some people throw it on the ceiling. Some people buried it, all manner of superstitious belief. And yet this tooth will grow back. Did you have to fall sick for that tooth to grow back? No is the answer. You never fell sick for that tooth to come back, to grow. That's the permanent teething. So they are all teething. So you ask yourself, why is it that at that stage they don't fall sick again? Why teething? Why must they fall? It's because of that lifestyle. Because hygiene has improved in a child of 7, 8, 9, 10 years. While hygiene is at its minimum in a child of 6 months, 1 year, 2 years, and under 3 years. Do you understand me? So that's the fact about this issue. So I want you to go out there and do the right thing. Do the right thing. Go take your child to the hospital to see a doctor. At least go to the pharmacy to get some medication. If your child is having high temperature, go to the pharmacy and complain. They can give you paracetamol depending on the age of the child. At least you can treat malaria, because that's the commonest cause of high temperature or fever in our environment. Now, if you try this 2 days, 3 days, the child is not getting better, please go straight to the hospital. Don't wait and say the child is teething, the child is teething. Some children, some parents have lost their children, have lost their child because of this. Some of them has presented so late that little or nothing could be done, and the child died, just have to die. Please do the right thing. Thank you for listening. Once again, my name is Obichukwu Daniel Anyekwe. I'm a medical doctor by profession. I am the doctor in the house, the doctor with you always. You can always reach me with your comments, your questions. You can criticize, you can advise, you can say your mind. Please don't forget to like my video, to share it, to comment on the video, you understand, and to subscribe to my channel. And please remember to click on the notification button so that once a new video is released, you can get notification for it. Thank you. Be safe, be healthy, and prosper. Thank you. Ciao, ciao.